And for someone who has not yet experienced, because you said it starts from the age of 50, is there any screening protocols for, typically all eye issues, but also specifically for age-related macular degeneration?
For screening protocol as such, there is no such screening protocol, but once diagnosed, follow-up is again tailored based on the type of AMD, and depending on whether it is wet or dry, the follow-up is usually either a monthly follow-up or depending on the severity, we usually increase or decrease the duration of follow-up.
And when you said that, you kind of do some testing, what are the kind of tests that are typically done for AMD?
So for AMD, again, best will be a clinical test where the ophthalmologist directly looks at the fundus and looks for signs of any AMD. But other tests like optical coherence tomography or a fundus fluorescent angiography, usually we do to detect, again, the type of AMD so that it helps us to guide the treatment process. And again, it is useful for follow-up also, to see whether the disease has responded well to the treatment or not. So these are some of the tests that we usually perform routinely for AMD patients in the clinics.
Right. And, in terms of testing, because typically by around the age of 50, you're also having reading glasses. So you're going and seeing an optometrist. Is there any indication that you will get through an optometrist visit on whether you have an issue or not, or at least an indication? I'm not saying that you will get a formal test, but will you have something that, or it's basically your own assessment of the symptom that you're having, central vision loss?
When these patients go to the optician and they get it checked, the vision acuity usually does not recover to the exact 6x6 that we say. They don't usually read 6x6 letters. It is usually slightly subnormal. It never improves to the extent that what normal individuals see. And many individuals, they experience something called as metamorphopsia that we say, where the lines appear blurred or zigzag. So this is one of the earliest indication that there is something wrong with the macular area.
Okay, thank you.